Hello everyone, I'm Dr. Nadine Hamilton from Love Your Pet, Love Your Vet. Welcome to another episode in our Thriving and Surviving in the Veterinary Profession webinar mini-series. Today I'm delighted to be joined by my lovely friend and colleague, Dr. Claire Stevens. Claire is a veterinarian here on the Gold Coast and northern New South Wales, I guess, as well. Sort of come into there, cover the two bases. She's also the author of this fabulous new book, Dr. Claire's Love Your Dog, and we'll have some links there on how you can get your hands on a hot little copy of this as well. It is absolutely amazing. We were just talking offline about how beautifully presented it is, and she's also got some online courses as well, communication and consultation skills for veterinarians. So there's lots of awesome things that Claire's doing, so it's so excited to have her on and sharing with you today on some tips around having the perfect consultation. So I'm going to hand over to Dr. Claire before I sort of waffle too much and get off topic. Handing over to you.
All right, well, I'll just get my screen up now so we can see that.
Get ourselves all organised.
Just let me know when you...
Yep, it's just opening.
Slideshow. Is it coming up now?
Yep, it just needs to go onto slideshow and then we're all good.
Okay, sorry, bear with me.
There we go.
Okay.
Perfect.
Yeah. All right.
All right. I'll keep quiet now and hand over to you, and then I'll chirp in at the end.
All right. So today I'm presenting to you guys how to have the perfect consultation, or as close as we can get to that, because I'm not sure the perfect consult actually exists. But before I get started, I'd love to introduce myself to you guys. For those of you who I haven't had the pleasure of meeting yet, my name is Dr. Claire Stevens. I graduated from the University of Queensland in 2009. So I've been a small animal vet for about 11 years now. And in that time, I've partnered in 3 small animal veterinary clinics. As Nadine said, I'm a published author. Recently, about 6 weeks ago, my book hit the shelves, so it was a very exciting day. Dr. Claire's Love Your Dog is a book I wrote for pet owners, for dog owners, written from a veterinary perspective. So it came about actually out of frustration, feeling like we have these 20-minute consults, and in that we might have to meet a stranger, build rapport with them, do a physical examination on their pet, figure out what's happening, perhaps even a blood test in there, do a treatment plan and see them on their way. And I just felt like doing all of those things in 20 minutes was really difficult. So what I tended to do was print off lots of flyers. So as I had them in there, I would have some go-to PDFs where I would print off a thing on itchy skin or ear infections or clipping nails or whatever things that were coming up regularly. Otherwise, I was hounding down the drug companies from really pretty leaflets and things that I could give to owners to educate them. And my receptionist just said, "That's enough printing, Claire." So then I went out looking for a book that I could recommend to clients. And this kind of journey went on for a few years, where I was looking for a good resource that I could recommend to people, which was written by a vet, and I just couldn't find it. So finally, I amped up the courage to write it, and that's kind of how this book was born. So it did take me a good 2 years to write. So I'm very proud to see it in bookstores across Australia. It's available in Booktopia online at Book Depository and Fish Pond and all of those ones, but also QBD and Dimix and you know, all the actual bookstores in real life as well. So yeah, that's the story behind that book. But these days I spend most of my time as a trainer for Global Vet Solutions. This is where we offer CPD for vets, and we train vets and nurses on how to create a more client-centered experience for our pet owners. And the reason I find this so important is that by creating a better client experience and by bonding with the people that we're serving, we're able to provide better veterinary care. We have the opportunity to provide higher standards of medicine. And my experience is that when vets are bonding with their clients and our communication is strong within the team, and we're providing good standards of veterinary medicine, we actually start to love our jobs again. You know, we have enjoyable careers. And not only that, we start to see the profits that come with it. And so to me, this is a really important formula that's being missed. And I think it does start with putting effort into bonding with our clients. So I'll share a bit more about that with you as we go on. And so while all this is true about me, I would say this is who I really am. I'm quite a tired, worn out mum of these little rat bags. I have Koa, who's 4 years old, and little Kai, who's 2, and they may be the most energetic human beings on the planet, but we have lots of fun. And I'm also a vet, just like you. And you might be surprised to hear this, but I'm actually an introvert. And even though I do love training and doing things like this, I also find it quite draining. And so I understand when vets say that they would rather be out the back doing an enema than speaking to a client, because I've been there and I know what that's like. And certainly I'm one of those vets who is also known to hide out at the back and do procedures because we want to avoid the consult room. But I have made some big changes in the way that I practice and the way that I consult to protect my energy, but also to have better relationships with clients and make it more of an enjoyable experience. So we'll talk about that shortly. So today's agenda is really a bit of a discussion about why most, or maybe many, vets are feeling frustrated, they are feeling unfulfilled, and even some will say they're broke. What's going on there, and what the ideal practice actually can be like. Some of the obstacles that are going to be standing in your way, and the 7 steps of the perfect consult. And I hope that you're not watching this webinar looking like this guy here sat on the screen sofa, because I know that when you say soft skills and communication skills to a lot of vets, they just go, oh God, here we go. But I hope that, you know, in at least 5 slides time, I'm going to have your attention. You're going to see the value in what we're talking about today. And then finally, I'll leave you with some things that you've got to do before you go. So to be in all honesty, this was me when I finished university and for the first few years out of practice. Sadly, I'd worked so hard to be a vet. I'd busted my guts. It was my single focus in my whole life, really, was to get there. And I got into vet school. It was great. I got out, and woohoo, here I am going into practice. And within a very short time, I felt unsatisfied. I was trapped in this profession. I felt really overextended, way beyond, you know, what was viable for me in terms of my hours and my energy levels. And sadly, I felt unappreciated, and I was just head pressing like this patient here. And this was quite a shock. And I wonder if there's many other people on this webinar who felt this way. You know, you expect to get somewhere and then you get there and it's not what you hoped it would be. And I actually felt like a big fat failure. And in those first few years of being out, I spent a lot of time thinking about leaving the profession altogether and what I could do outside of the veterinary industry. And it was a really sad time for me, to be honest with you. The problem I think we're facing is that vets are working very long hours, and we're often working in very stressful environments, very demanding work environments where we're focused on trauma in our patients, but also in our pet owners. You know, they're coming in anxious and distressed. We may have very little support or no support, especially in those early new grad years where we really need it most. And some of us report feeling undervalued, and I certainly did feel that way initially. And I felt like in that new grad wage, I was being I was finding it unrewarding. So, you know, from an emotional level, but also from a financial level. So these were some of the challenges that I was dealing with when I was feeling this sense of being a failure. But thankfully, I learnt that it didn't have to stay that way, and that the sun can shine again, and that there was another way of operating. And that happened when I made a commitment to change. And I tell you this because it went from such an awful place to such an incredible life and career in the veterinary profession. And so I want to share that with you guys, because there was an opportunity there for me to leave, or an opportunity for me to change my thinking, my attitudes, and my beliefs. And these were beliefs around who I was and what my profession was, what it meant to be a vet, but also what my clients represented and who they were. Instead of seeing my clients as a barrier or as something I had to overcome to get to where I wanted, which was to do surgery or medicine, I started to shift my ideas of what my client was. And this had a really massive impact on how I practice. I started to focus on my consults and how I was bonding with the clients and the client experience that I was providing as a vet, and how they felt when they were in the room with me. As I focused on this, I noticed that people started to connect with me. And, you know, not only did I feel like a really, you know, a wonderful sense of warmth with them, but I noticed that they loved me as well. And it was a really big shift in how my consults used to go. I felt connected with people again. What that meant was I didn't have to sell. They were you know, we were on board together. They trusted me, and they were on board with my recommendations. And I found that, you know, I don't know what the stats were, but I would say 90% or more would return the week after for the recheck that I booked in for them. And soon I noticed that these clients requested to only see me, and things just started to change in the way that I practice. I felt appreciated and I felt important. I actually loved seeing these people. They were like, you know, friends, but chatting to friends in my consult room. And as a consequence of all these shifts, my KPIs improved. And I know that vets sometimes are a bit hesitant to talk about KPIs, you know, our key performance indicators, how much money we're generating per consult, how much money we're generating through dentals or pathology or selling food. But I don't think that this is something we should shy away from, because it is an indicator of how effective we are in doing our job. And by looking at our KPIs doesn't mean that we are money hungry. It just means that we are aware of finances. We're aware of how we're providing for our family, if we have scope to negotiate a pay rise, and if we are being effective in having good consultations where people are saying yes to our recommendations, as opposed to saying, oh, I'm not sure if I trust this vet, I think I'll get a second opinion. So my KPIs went up. And I noticed that as I focused on communicating effectively, not only with our clients, but with my team, that was another area I wasn't making of paramount importance in my day-to-day practice. But as I did this, my levels of fulfillment dramatically improved. We saw clinical outcomes improving, and client satisfaction was definitely skyrocketing. And at this point, I was in my first practice, and from this shift, we saw a 38% practice growth in 18 months. So that is pretty incredible outcome from where I was to where I ended up after, you know. And I have to say that I had a psychologist. I was doing a lot of active things to change my thinking, to change this whole thought pattern and perspective of the veterinary industry. But it had an incredible impact for me. So whether you are a practice owner, I mean, you'll be seeing this and be like, wow, this is really important stuff. But even if you're an employee, this is just as important. And as I said, your income is important to you. So if you are able to improve your KPIs, you're able to negotiate a salary increase. And this is a ticket for you to be able to do that. So this is where I ask, who's interested in communication and consultation skills now? Because usually I have a little bit more interest after that hook. My reason for sharing all of this with you guys is that I truly do believe that veterinarians, the veterinary profession, deserve better. And when I experienced this change for myself, I felt a real need to want to share it with others, because I want you to have a happier life. I want you to have a better income. I want you to feel more fulfilled and have a healthier sense of well-being. But what I'm seeing is that being a vet is really hard. And, you know, I see this because I'm still practicing. And I see it because I also have Global Vet Solutions, and I speak to vets all the time. And they tell me it's hard. We're suffering from stresses, from compassion fatigue, from long work hours, financial pressure. Some of us have professional isolation. We have the client issues, blackmail, unrealistic expectations, and there are many vets that still have unbalanced lifestyles. And what we want is more time with loved ones. What we want is more time for our personal interests. And we are happy to be committed. We're happy to be compassionate. We're happy to be hardworking, but we just want to be respected, and we want to be paid fairly for it. And we want to find our way through this maze that is the veterinary profession. But what is important to know is that no matter what got you where you are now, it's not going to get you where you want to be. And, you know, we're all really proud to get into vet school. We're all really proud to graduate, to get our first jobs, to get a partnership, own our first practices. But then we get there and we're all excited, and it's actually not what we expected it would be. I actually find that we're a bit disempowered or a bit disenfranchised by the life that we've worked so hard to get. And we figure that actually we want something else. We want more time with our family. We want to spend Christmas at home one year. We want to be able to get away from the clinic every now and again. But the definition of insanity, we know, is doing the same thing over and over again and expecting different results. And so if we keep doing what we've always done, then we're only going to get the same results as we're getting now. And this was kind of the big lightning strike light bulb moment that I had when I thought, okay, so all of those strategies that I was running to get through vet school and to study hard, I'm trying to do as a new graduate in a clinic, and this doesn't apply. And so I'm not happy. So things have to change. I have to do things differently. And so that's kind of was the turning point for me. And sure, there's going to be blocks in the road to this change. You know, you're going to have to deal with industry norms, your clients' expectations, the clinic's culture, if it's not a very healthy one. And probably the biggest thing of all is your own mindset and your own beliefs. That they can be our worst enemy. But to get from where you are now to where you want to be, all you need is resources. Now, resources can be internal or external resources. These are just things that we need to get from where we are now to where we want to be. So the external resources are things that are outside of us, you know, things like money, having more staff. If we had more nurses, then we'd be okay. If we had new equipment, if we were able to market to, say, a higher socioeconomic area, then we'd be better. If we had more time between consults, they're all the external things that we can brainstorm. But there's also internal resources that come from within you. And when I'm workshopping with vets, we write these down on the whiteboard, and a lot of these ones that I've listed here come up. If I had more confidence in practice, if I had more confidence talking to clients, then that would make it easier. If I had the know-how, like a checklist or a system on how to run the day more effectively, if I had a checklist on how to have an effective consult, which, by the way, is something I'll give you at the end of today's webinar. If I had better consultation skills, or I had some training in leadership or time management, so I didn't run late in my consults. These are things that people say they would love to have as internal resources. And as a result of this need in the veterinary industry, this is what I do with Global Vet Solutions, the internal resources. And so now I ask you, do you want to keep doing things the old way, or are you interested in learning the new way? Because I can guarantee that by learning how to consult effectively, good things will come in your career. If it's not just the way you feel in the consult room, but the way you feel about your job, the way you connect with others, or about your bank balance, good things absolutely come from honing in on these skills. And so with that, I'd love to go through with you now the 7 steps to the perfect consult. Now, we're going to go through first impressions. These first few moments of a consultation are absolutely golden, and they can make or break this whole consult to come. I'm going to talk about the skill around empathy and also ditching the jargon. Okay, we've got to try and remove some of this medical lingo that keeps slipping into our consults. I'm going to talk to you about watching your tonality and how important it is, and then 3 skills that you should be using in all your consults: summarising, signposting, and safety netting. So let's get into first impressions. So let's imagine you've got your client in the waiting room, you've never met them before. You would not believe how important this opening line, when you go out to meet them, how important it is. So I encourage all the vets I talk to, the first time they meet a client, use the client's name, use the pet's name, introduce your name, and mention that you're the vet and that you'll be doing their appointment today. So something as simple as, "Hi Sally, I'm Dr. Claire. I'm your vet today. I'll be doing Fluffy's vaccination and health check. Come on in." It's a really assertive and confident, friendly, warm way to get the consult started. And it doesn't leave any question marks around, who is this person? Could it be the nurse doing a pre-check, or is it actually the vet? Is this, does she know my name? Does she know my patient's name? Does she know if the patient's a boy or a girl? All of these things in one statement are sorted out, and you do it confidently and fluidly as you welcome them into the consult room. If you've seen them before, you don't need to do the who you are and that I'm your vet today. You can just say, "Hello, Mrs. Jones, come on in, how's Fluffy today?" But again, you're using the patient's name as well as the owner's name, and you're doing it in a warm and welcoming and confident way. I always encourage people to be 100% present when they're in a consult with their client. You just cannot be somewhere else. People know straight away if the vet is not there, if they're thinking about patients out the back or the kids at school or what they have to do in their lunch break. People pick this up, and they're paying you a good amount of money for a 15-20 minute slot. So they want to have your attention. They want your eye contact. They want open body language where you're smiling at them and you're listening, and you're showing warmth. What I see too often is vets talking to their computer and typing, or mumbling as they look down to the patient. They just see them in and they go straight down to the animal and mumble their greeting to the owner, but they're actually talking down into an ear canal. It's just, you just cannot build rapport in that kind of environment. So we're always encouraging to greet them, give them space, smile and listen, and show your support by encouraging them to talk without interrupting. So lots of vets, studies have shown, say, "Oh, come in, how's things going with Fluffy?" And the owner will start, and then the vet will jump in. "Okay, so has there been any blood in the feces?" And then the owner's kind of story is being derailed. And now the vet is just getting in on their agenda and kind of shooting bullets of questions that they want to know. And it does not only break rapport, but it means that you won't get the full picture. So showing your support by making encouraging noises, okay, nodding your head, a gentle smile, was there anything else? More open questions can flesh out more of the story. Now, what we're finding is there's a growing number of academics that are publishing research showing that vets need to listen more. We need to treat our clients as fellow human beings with real emotional concerns, real issues that they've come to us, that they've paid to see us. They're not a barrier for us to get over or to get over and done with so we can get it out the back into surgery. They make up our business. We are a service industry and we have to deal with people all day. So I think sometimes we do forget that these are the people that pay our wages and these are the people that recommend our practice to others. So they do deserve all of these things. They do deserve us to be present, for us to make eye contact, to smile, to hear their story without interrupting. And I would say that these first few minutes are the make or break of your consult. Empathy. Oh, I love empathy. It is the key factor in developing rapport. Empathy means you're tuning into your client's feelings. It's different from sympathy, where you might feel sorry for someone. Empathy means that you feel as if you are that someone. So you're really putting yourself in their shoes and imagining what it is like to have a dog that's suffering from diabetes and you can't get the dosage right, you know, for example. I really believe that whether you're on reception or you're in the consult room or you're calling up a client because a dog's in hospital with you, you've got to put yourself in their shoes, because that's where excellent client care starts. It's really easy for us to be run off our feet and, you know, the nurse says, oh, you've got to call that client for an update, and we just get on the phone and just try to tick that box on our job list. But imagine how that client's feeling. They've been sat by their phone for the last 2 hours waiting for the vet to call, to have a really focused conversation about how their dog is doing and if they're going to make it. You know, it's a totally different world to our busy day in practice. So it does require a degree of vulnerability to be empathetic. And I do know that this is why sometimes vets feel like, oh, I just can't go there. I'm already exhausted enough. But I find that once you do start doing, you know, some of these activities around vulnerability, you can learn these skills, you'll notice that it has a much better result for you. And so it's worth doing. So you can be demonstrating empathy through verbal modalities and non-verbal modalities. So we can do it by acknowledging suffering, using comforting words like, geez, Julie, it must have been really hard for you to see Fluffy being attacked on the beach today. Are you okay? That is a verbal empathetic statement. Non-verbal empathy is just a concerned frown or a nod or a kind smile, a hand on the shoulder or on their arm. You know, they've been through an upsetting event, and so you can show empathy through that. Okay, the next one is summarising. Okay, so we're going to show you have listened, and we're going to check that you have interpreted the client's story properly, and you're also giving the owner a chance to correct you. And we do this through summarising. I summarise the client's story usually on 2 times in a consult. I do it after getting the history, so in that initial phase of first impressions, when they tell me their story, I reiterate it back to them, and I do it again at the end of the consult. So I might say, so may I check that I've got this right? And geez, I have to say, how many times are you in a consult and you've got a husband there and a wife there, and you're trying to get a history on how long the dog's been vomiting and had diarrhea and what it eats, and the husband saying, oh no, the vomiting's been 1 week. The wife says, no, it's been 5 weeks, and no, we never feed it bones. Oh, except I gave him that lamb shank. And then there was that time he had the blood in the species, and the vet is just like, oh geez. So summarising is your opportunity to try to map this out, and the owner will be grateful for that, and they'll also say, oh, actually maybe we got it a bit wrong there. They'll have an opportunity to correct you. Another way is that at the end, you're just wrapping up the consult and you're wrapping up what you found in the examination and the treatment plan. So you might say, Julie, you came in today with 3 main concerns. blah, blah, blah. What we found on the physical examination was X, Y, and Z. So what we're going to do is we'll trial this treatment and we'll see you back in 7 days for a recheck. So that summarizes basically the whole consultation experience, and it's a nice way to wrap it up and communicate as you're walking out. Signposting. Okay, now it's really interesting to think about this. The veterinary practice is a very familiar territory to us. We've spent hours in there, right from university to our day-to-day lives now. We know how a practice works. We know the sounds, we know the smells. But to a client, this can be a very alien experience. They might not be used to all these dogs yapping and howling. They might find that upsetting. They might find the smells confronting, or the waiting period longer than they expected. It's not necessarily the same experience for them as it is for us. And so what we find is clients can feel lost and confused and even distressed when they come into the consult room. So again, we need to put ourselves in their shoes. And I know for myself, if I can think of times that I go to a professional for a consultation and I find I feel a bit anxious or I'm a bit out of my depth. I'm not really good with spreadsheets and lots of numbers and stats. And so going to the accountant and looking at profits and losses and doing tax is a real killer for me. I'm in a bad mood as I'm driving there. And also I went to the Apple store recently because my computer died and I had to get a new computer. And the same happened with the guy talking about computer stuff. You know, there are places and experts that are overwhelming for me. So when I think about that, I can understand how some clients feel when they're in the consult room with me. And so using explicit statements that can inform clients about what we're about to say and what we're about to do and guide them along can be really, really effective in supporting them when they're in this alien territory. So let's look at an example now. So say we've got a client, she rushes into the consult room. Oh, Dr. Claire, I've been up all night. Sammy's been scratching. He's very distressed. He's been crying. Now he's got blood coming from his abdomen. I need a different treatment. This cream isn't working. So you've obviously got a very distressed client who's going straight to the treatment plan, and they have lost sight, or maybe they don't know about the structure or flow of a consult. So you can use a signposting statement in this scenario that can inform them that and make them feel more calm, that you're in control. So you could say, all right, let's first look at Sammy's itching. Or let's first talk about Sammy's itching, how long it's been going on for, you know, what are the triggers, and then I'll examine him. And after that, once we've got a better idea and maybe even had a look at his skin under the microscope, we'll talk about some ways that we can treat it more effectively. So that's a signposting statement, which you're allowing the client to see the steps of the consultation experience when they're feeling a bit overwhelmed and wanting to start with talking to you about treatments. Another really good use of signposting is an example where you've got an elderly lady, for example, where she is very bonded to her cat, but you can see that the cat is not well, and euthanasia is probably the fairest option. So rather than saying to a client in this scenario who's not ready to let go, I think we should euthanize your cat, that's going to be very confronting, and there will be no signpost to that serious and difficult conversation. So a better way would be to broach the topic is to say something like, I'd like to ask you some questions today, Mrs. Jones, about Lulu's quality of life, if that's okay. Now she's going to know that this is a serious conversation. She's going to deep down have some of her own concerns about Lulu's quality of life. And so this allows her to prepare herself for this difficult conversation, which may lead to the discussion around euthanasia. So that's another example of an effective signpost. Okay, number 5 is ditch the jargon. Now I know you've spent your whole life training, learning, understanding medical language, and now I'm telling you to throw it out the window. But you absolutely must if you want to connect with your clients on a way and on a level that they understand. And honestly, I feel your pain because I wrote that book. It's like, it took me 2 years. It's over 100,000 words and there's a lot of jargon in it. And I tried my best to deliver this important information in a way that clients could understand. And I know it's tricky, but the fact is not everyone finds science and medicine as compelling as we do. And when we speak in our textbook terminology, we're actually alienating them. We're actually creating a gap and like, you know, we're creating a barrier between us and them. And so what I encourage all vets to do and all veterinary nurses is to provide information in that's jargon-free and in bite-sized chunks. And we can check in regularly and have an awareness that this is new and could be quite overwhelming information. So statements like, I'm sorry, Julie, to bombard you with all this today. I know it's a lot to take in. Do you have any questions so far? Is this making sense? Am I explaining this okay? Now, this is really important for discharge appointments, particularly with things like orthopedic surgeries, things where there's lots of take-home advice in terms of keeping the animal restrained, medication, bandage care. This is a lot for owners to take in. So using these check statements is valuable, as well as, I know it's a lot, Julie, please feel free to stop and ask me any questions as I'm talking if it's not clear. Now, this is giving our clients permission to jump in and to say, I'm not sure what you mean by twice a day antibiotics. Is that twice a day in the morning, or, you know, so then they have an opportunity to not feel silly asking you questions. Number 6 is tonality. Now, there's this study, I've put the reference for you there. It was done in human medicine, and what they found is they looked at the tonality of surgeons' voices, and they were able to determine the surgeons who were more likely to be sued and who were more likely to obviously have much less rapport with their clients than doctors that had good rapport and weren't getting sued. And what they found is the doctors that were getting sued were the ones that had deep, loud, moderately fast, and very articulated speeches. So the way they tested is they jumbled up the actual words, so the message was lost. It was just the sound of the tonality. So basically, doctors who sounded superior and who talked down to their patients were disliked and ended up in courts more often than those who spoke more kindly, softly, more gently, with more respect. So in other words, nobody likes a dominant know-it-all. Nobody likes their vet or their doctor to be cocky in the way that they communicate. And that is a lot to do with our tonality. So there's a lot to be said around how we communicate, not just by the words that we say, but how we sound when we deliver that. And so this is a really interesting study, and I think we could, extrapolate these findings to veterinary medicine as well. Okay. Number 7, safety netting. This is the last one. Now, it's no surprise to anyone that uncertainty is a constant in veterinary medicine. Even though we try to understand and predict exactly what's going to happen with our patients, we can never know for sure how they're going to respond to treatments or what exactly the right diagnosis is in the early stages. So we have to prepare for the unexpected, and this is an important part of communicating clearly with clients. You need to communicate the possible outcomes to the owner. And I find the best way to do this is to ask these 3 questions. If I'm right, what do I expect to happen? Well, you're going to expect the animal to respond to the treatment plan. How will I know if I'm wrong? Okay, so what do I need to talk about to the client if this diagnosis or this treatment plan is incorrect? And if that is the case, what will I do then? So an example of this would be at the end where you're speaking to your client and you're talking about your treatment plan and your safety netting. So Julie, if I'm on track here, I'd expect that the antibiotics are going to start to take effect in the next 2 or 3 days. However, if Fluffy is not improving, then you're going to put your disclaimer in, okay, so that they need to come back to you. Even though you might schedule the recheck in a week's time, If they're not improving or they do develop more clinical signs, then they need to call or return immediately. And in which case we may need to go on to additional blood tests or x-rays, or I may need to refer you to Dr. blah blah, the specialist. So your safety netting, what could possibly happen? Because if you just say, all right, apply this cream twice a day and I'll see you in 7 days, when that case goes pear-shaped, what are they going to say? That's a terrible vet. So safety netting protects us and communicates to our client the possible outcomes, and that, hey, this might not be the end. We might be seeing you back for those x-rays or those bloods, or we may have to refer you to the specialist. So it is an important step in at the end of the consultation. Now, sorry, my screen's not working. Okay, so what now? We've gone through those 7 steps. Well, basically, guys, if you don't apply these things, if you're not writing these notes down and you're not thinking, oh, how can I start introducing these techniques into my consults, then you'll forget it. And there's no point watching this webinar at all, because we have habits. And actually, the more time that you've been consulting, the harder this is going to be to introduce these things. So you have to apply it. Now, to help vets apply these strategies and a lot of other tips and techniques, I created an online course. Now, this is a system that I built. It's called the Effective Consultation and Communication Course for Veterinarians. It's delivered over 5 weeks. There's tons of videos and webinars in this online course, and it's endorsed and supported by the Australian Veterinary Association. So thankfully you will get your 15 vet ed points for completing it. So it's about a year's worth of CPD in terms of points. Thankfully, what we're seeing is participants are reporting feeling more fulfilled in practice as a result of having better clinical and business outcomes when they are implementing these skills and strategies. What I'd love to offer today is a little deal, a little gift for the people who are watching this, because we love your pet, love your vet, and anyone who's associated with it. So we're giving a 15% discount to anyone who is watching this webinar today. So I'm going to give you a discount code, which is going to save you over $100 on the course. So if you are interested in some of the things I've been discussing, go to globalvetsolutions.com.au. If you go up to the tab that says e-learning, you can see there it is there, where the arrow is, and go to buy now. You can enter this discount code, which is promo 15 off, and that will calculate at checkout your discount. If you're not interested in that, that's fine. But what I would suggest you do is download this. It's the 6 steps to the perfect consult. And what I'd love to see is that this is in the cupboard door of your consult room, or in the, the tea room, where you can go, oh, actually, I run through consults every day, but I'm not sure that I'm doing step 5 in those. Maybe in the next one, I can implement that. So this is a very simple checklist that can just help. It can help nurses who are new to consulting and new grads, but it also can help us oldies who've developed bad habits. I think often it's the experienced vets that are the worst at learning new skills when it comes to consulting. And this is my little poster that I made initially for myself in managing my stress levels in practice. And I sent my terrible drawing off to a graphic designer and got it made up for everyone else. So you can also download this from Global Vet Solutions. It's veterinary specific, and it's just the tips and tricks you can do to manage your stress levels throughout the day and make sure that you're keeping as balanced as you possibly can. All right, that is all from me. Thank you so much for listening. There's my email there. Feel free to contact me. And Nadine, thank you so much for having me. Are you still there?
I am. Thank you. I was listening and writing intently. I've got my notepad here.
Oh, good.
Thank you. That was brilliant, Claire. Sitting there, and it's also nice. I know you were just talking then about the oldies, and I was just thinking, oh, you can't teach an old dog new tricks. And I'm sort of like, well, I'm a bit of an old dog myself, and so I get a lot out of listening to other people's information and presentation, and I was like, oh, okay, yep, that's really good, and this is good. And there was, I guess, so many things there as I was listening to you. Firstly, I think when you were talking about being an introvert, and I'm like, and I know we're both Geminis as well. So people, I think, typically think, oh, you know, we're chatterboxes and we don't shut up. And, you know, it's like, I have my moments. But I think, I mean, I am very introvert myself. You know, I used to hide behind my sister as a child. I was that shy.
Right.
And I still am in new environments. I mean, I guess I've sort of learnt more the older that I've got. But if I have to go to a scenario like a networking event where I don't know anyone, I am lost. I'm just like, no, can't go. So I'll avoid it, you know, because it's like, I don't want to strike up conversation with someone I know or ease my way in and, you know, start talking to someone. It just doesn't feel right. So it's really interesting. And I think there's probably a lot of vets that are in the same position and not wanting to have that communication with the clients.
Yeah. And I always found being an introvert or extrovert a bit of a difficult one to understand for me, because when I'm in the zone and I'm around people, I love it. And you know, when we have people over for dinner, I'm in my element and I'm a chatterbox and I love it. Or same in the workplace, you know, when I've got my strong relationships with people. But when I'm with lots of people that I don't know, or I'm seeing lots of consults in and out for a full day, these can be really draining scenarios for me. And that's how I realized that actually while I love people when I can have kind of control over how many and how often, retreating back to my own work. And I guess that's why I've done things like written a book and written this course and moved my career in the way it has, because I found that that's much more sustainable for my personality type, because I do get that me time.
Yeah, absolutely. And I think you're right. I think it does come back into having control over the environment that you're in and the people. Like, I'm exactly the same. If I know people, I think it also comes down to that fear of being judged, maybe, and or rejected. Like, what if I go and join this group of people and they don't want me to join in? How will I then feel? So I think that has a lot to do with it as well. So, and I'm the same, you know, when I'm around people that I know or I'm comfortable with, that's it. I don't shut up. So most people, I think, find it very strange when I say I'm actually an introvert. They're like, you. But again, I think when you're confident about when you're talking, and, you know, like I can talk to hundreds and hundreds of people, you know, at a speaking gig, that's fine, you know, because I'm confident talking about it. But it's completely different when you're like one-on-one and you have to go and make that connection, I think. And I also love not hearing your sad story, you know, and how it sort of came in feeling like a failure. That's obviously not nice to hear, but loved, I guess, you know, it doesn't have to stay that way, that you made that commitment to change. You know, I think that is a really significant point, but also very encouraging for those who are feeling the same, you know, because I know you're definitely not alone in feeling that way, or weren't alone, you know, when you were feeling that way. And it is so common. I think, like in lots of different professions, you know, particularly in the veterinary profession, where we have high levels of imposter syndrome going on as well, and just those thoughts and those feelings, but making that commitment to change, you know. And of course I was excited to hear, you know, that you talked to a psychologist, and, you know, that was really helpful, because obviously I'm a little bit biased with that, but, you know, but I think also because there's so much stigma, you know, around talking around mental health, and, you know, talking to a psychologist, that people think it's a sign that I'm not perfect and I should be able to deal with this on my own, and I have to cope.
I was so terrified when I realized that I needed to do this, and that I had to go and confess this to the GP to get a referral. Like, I look back at see how scared and inadequate I felt in that initial process, because it was so foreign, and I thought, you know, oh God, I've really hit rock bottom now. And then the more I did it, now I'm addicted to it.
Exactly.
Now I can't stop telling people how important it is to have someone to talk about things in a resourceful way, and to manage emotional pressures, and just to have this support that can't always be your husband or your mum or your family members, to have someone outside of us. And I think there's a role for a psychologist in every single person's life, in some point of their life, or if you need it more frequently. But yeah, to looking at how scared I was and what it signified as such failure to me, and going to that appointment, like I was shaking in the waiting room, and then to now I'm like, good morning.
Yeah, I'm off. Yeah. And I think, but it's so common. And like, I've really, struggled, I guess, to really get insight into why it's so hard, in particular for vets, to reach out. And I think it does come into that high performing, perfectionistic tendencies for the majority, that it's like, oh my gosh, then this is perceived that I'm a failure. But I think what I like to reinforce is, you don't have to be struggling psychologically to see a psychologist. You can see them for your well-being as well, and maintaining that good mental health. But also that, we're not there to judge. We're there to help you. Like when, I know there's probably pet owners that go, I don't want to take my pet to the vet because you're going to think that I'm a terrible owner because my dog's teeth are disgusting. It's sort of like, and if there's some resistance there, whereas you're like, no, just bring it in. The sooner you bring it in, the sooner we can do something about it and get Fluffy healthy again.
That's a great analogy. I've never thought of it that way.
This came to me then as well.
I love that.
But I guess it is sort of feeling like that, I think everyone knows our story with our little Burmese Aussie with his diabetes, and was sort of like, oh my gosh, that makes me feel like a really bad pet owner. That have I done something to contribute to this? I'm like, I don't think I have.
That would never judge you on that. Just like a psychologist would never judge us.
Exactly.
And actually, once you start talking to a psychologist, then you realize, like, whoa, I live I've got a lot of pressures. Like, no wonder I feel this way. This is these are significant. And yeah, I remember feeling like looking around me to make sure no clients saw me going into the psychologist building, because I had this idea that I should be this all perfect veterinarian that they came to for help. And if they saw that their vet was actually going to a psychologist, what would they think? But now I was like,
and now we think,
what's even, they would never judge that.
Exactly.
I would not even think of link between that building and my appointment. So
because you're so sensitive and it's such an issue for you. And I think that's why, I have a lot of clients that I do online sessions with, because there's no stigma around it. But it's also that fear of opening up. I can't tell you the amount of clients that I had, even when I had a physical practice, that would come in, and I could see how anxious they were, because it's very stressful that first time. What are they going to be like? Are they going to judge me? Am I going to have to delve into my traumatic history straight away? And, all of these sorts of things. Am I going to make that connection with them? There are so many fears that can go through your mind. And once you're able to put the person at ease, same as you're doing with the pet owners and the pets, we're sort of doing the same. We're not there judging, we're there to help and support. And I think that's a big differentiation, where a lot of people don't necessarily realize that. And it also comes back to whose opinion really matters. We tend to put other people's opinions over above ourselves, whereas really it should be our own opinion that should matter the most.
And I think after you've done a few sessions and you start to feel a bit empowered, then you start to be like, oh, actually this is about my life and my well-being, and you start to get more resourceful around those.
You're taking control.
So vulnerable that now you're really concerned about whatever people think.
Absolutely.
And vets are concerned about what other people think. I think, more than I definitely was. Like everything I do, for some reason, I think what vets will think of me. What will vets think of my book? Will they? I'm sure they'll disagree. There's got to be things that people are going to disagree with. Like, I wonder if they're going to slam me, publicly. I wonder if that photo's got too much makeup on for vets, or I wonder how they'll feel about me doing consulting course. Like, why?
I do, absolutely.
Why this is happening.
Absolutely. As a fellow author, I can relate. As well, but I absolutely, because again, it's us not feeling like we're good enough, or we're starting to question ourselves. Whereas, you know, we're just saying, hey, I've had the courage to get out there and do this. I'm putting myself out there and I'm doing this. And sure, there'll be people who don't like it or disagree, but, you know, a lot of that can be that professional jealousy, or just that resentment that, oh, I wish I had have done that, or they don't have the courage to do it. And, you know, so it is, it's just, it takes a big leap of faith to get out there and do it. But then, you know, when you see how positive it is, then the rewards start to follow. But it is, I think we're all like that. Have I put enough information? Is it factual? Have I cross-checked everything? And, you know, all of those things that come into it. And I think, I mean, I couldn't agree more. Like, you probably couldn't see me on the screen when you're going, you know, vets deserve better. And I was nodding my head on yep, that respect and being way pal. But I also, when you were talking about the KPIs, and I love how you like turn that around a little bit to show, you know, this is actually you showing, you know, what you're doing and your contribution. But I think it also shows the value you're providing as well. You know, this is the value that I've provided to these customers. This is the value that I've provided to this practice. You know, I think they're also important differentiations. And I think, yeah, I was writing notes as you were going. I love, you know, the quote, you know, do what you've always done, you get what you've always got. I think it's an Anthony Robbins quote, but looking at those sorts of things, and it's so true, you know, if you want things to change, you have to do things differently. And it's, what is it? Wasn't it Henry Ford that said, if nothing changes, then nothing changes. Exactly. And it's so true. We have to step outside of our comfort zone and get that change, you know. And if we accept, hey, there's always going to be someone that doesn't like it for whatever reason, but that's fine. You know, whose opinion is most important to me. And as someone said to me once, you know, you can't please all, but you can please most. And I think that's part of it. And I think as you were going through your 7 steps, I think, like, I loved your signposting one, actually, like informing the client of what you're about to do. I think it is such a basic thing to do, but I was putting myself in the position of a client, you know, when I go to our vets, and, you know, we have a few different vets at the clinic where I go to, and just thinking the differences, you know, with different vets that I've seen, you know, over the years as well, here and interstate, you know, when we lived interstate, just the differences and how much, like, if the vet said, right, this is what we're going to do, I would be like, yep, that's awesome, great, you know, and putting it into simple terms. Like, when it's these big terms, that's pretty daunting. And you know, like when we went through our journey with Ozzy with his diabetes, and then, you know, he had, you know, 4 days in ICU at VSS here, and, you know, the specialist vet, who is absolutely brilliant, you know, she would say, okay, we think he's actually got this, what that means is this. And so she would say, this is the term. So I'm writing it down, so I felt really important, so I can say these big names. But then she'd explain what it is. And I'm like, okay, that makes sense. Because I would Google things, you know, and go, what does that mean? And what is the outcome for that? You know, so the difference with having things just explained in terms that I could understand, you know, as a pet owner as well. And obviously feeling stressed and feeling worried, you know, is my cat going to survive? And all of that, having it in simple terms, you know, is something that I think is really, really important with that. And it was interesting, the study that you were saying with the surgeons with the tone. It's sort of like, yep, I reckon I could relate to that, when you sort of hear those, you know, who are easygoing and just make you feel comfortable, you know, that rather than the whole formal superiority kind of things. Yeah, absolutely. Absolutely. So
yeah, I went to the dentist, to a new dentist last week, and I couldn't believe when I left. She was great. I really loved her and her consulting style and her communication. When I left, there was a lot of things that we talked about, and I couldn't remember the details of them. Like, I couldn't believe how little I recalled of that consult. And so it just reiterated to me that those skills of signposting where you're going, summarising where you went, even though she was great, I was shocked that my retention of her advice was so little.
Yep. what is it, like 3 things, or is it 7 things that we can remember? I think it's 3, or if like it's a maximum of 7, and we tend to remember the first couple and the last couple. Was it like a 9s or something? So I do that like a memory chain. If I have to go to the shops, I have to run errands, I'll link it up like and make an acronym out of it, or think, right, I have to get 7 things when I go to Woolworths. I usually come out with about 27 things, you know, all those things you don't need, but like, I might need those. But that's why I like online shopping instead, to do the groceries. But using those little links to remind you, right, I need, you know, I need bread and I need milk and I need this, and just to use those cues. Because it's very easy, and particularly if you're overwhelmed or you have to learn medication, I find myself, I have to repeat, you know, when I'm at the vet, right, so it's twice a day, can you write that down for me? Do I need to do it now, or do I do it in the morning? Because it makes sense as we're having that conversation, but like you said, when you walk out that door, you're like, no idea.
And what I find a really useful tool, you just reminded me, is letting the computer go in the consult. And I know that this is hard, but getting an old-fashioned clipboard. And that can be great for 2 reasons. I have the first page is for me. So when they're telling me notes about how many days it's been vomiting or whatever, I can just jot that down rather than turn my back and type, which is going to break rapport. I mean, you just have to have coffee with someone who gets their mobile out and starts writing. It's just, it throws you.
Distracting.
And you don't feel like they're being present, even if they are writing down what you're saying. It definitely breaks rapport. So you turning to your computer does change that. So writing down on a piece of paper their notes, and then you have that piece of paper to fill in your computer stuff later, but you have another piece for them. And so I've got a GP who does this. So she says, okay, you've got to go get this from the chemist. This is time for that. And so now I've got my piece of paper. I'm like, right, this is what I'm doing.
We know exactly.
That's a really simple but very helpful thing that vets can do for their clients too. Get the old trusty clipboard out.
Yep, I love it. And I think it reminded me when you were talking about, you know, that the clients are paying you a lot of money to be in that session and to have you paying attention. And fortunately, with all the vets I've been to, I've always felt that, which is great. But I do remember seeing a specialist when I was pregnant that during the middle of my consultation, and I can tell you I was paying him a lot of money as a private patient, and in the middle of the session he picks up his phone and says, oh, excuse me a sec, and starts having a conversation, and I'm like, I'm paying you a lot of money to have this, and I've got a very limited time frame that I'm here. And I was like, that is just exactly, I'm not paying you to be on the phone and talk to your family. Like if it was an emergency, 100%, I would, you know, that would be fine. But, you know, I thought this isn't an emergency. It was a casual phone call that he took in the middle of a session. I've had it with a doctor as well. And I've just thought, no, it's an instant. Like, no, I'm finding somewhere else.
Example, but I see it all the time in less extreme examples where vets or professionals are just distracted. You can see that they're not present. You might say something and they ask a question about something you just said. You know, just not there. And so taking a phone call is terrible, but even having your mind running about your surgeries out the back or something else is, people sense it and they're not going to see you again. Absolutely.
And that has been probably not so good for the vet staff, but doing the driveway consults at the moment, because you're not distracted by anything else. You know, we've had conversations with our vets, you know, out on the footpath while we're outside, you know, the clinic having and it's just there's no distractions around. You don't have to, it's like, this is great, you know, and I'm thinking this is awesome. They're getting out, they're getting the fresh air, they're outside of that little room.
Getting under the sunshine and
it's awesome. We could clearly chat for this about this sort of stuff for hours. But thank you. I love your online course as well. So you're www.globalvetsolutions.com.au. Thank you. That a 15% discount. I think that's awesome. But don't forget to enter the code to do that. And that's this course, isn't it? Is that one?
Yes. I printed you out the whole thing.
Yes, I've got. It's chock-a-block.
A lot, but the students won't be so overwhelmed with all of that. Split up into 5 weeks, so they'll get a downloadable PDF every week along with webinars
with everything,
and so they can go through it chunk by chunk.
And this is it's action packed. There is so much information in there. I think it's absolutely brilliant. And of course, I'm going to give your book another plug. So like I say, we've got some copies through Love Your Pet that we're going to do a bit of a promotion on. I'm not sure whether we would have already done the promotion by the time the webinar goes, or whether we'll do it in conjunction with the webinar. So yeah, we've got some copies here that we've bought so that we can support obviously yourself as well. And this, I just love it. I just think it's the most gorgeous looking book. It is so nice, and it is so easy to read. You know, I was flicking through before, and I think when you were talking about the tonality, and with one of the points there, like with puppies, like the high pitched voice, but then the older they get, so I was sort of like, hey, that's pretty cool.
That does no tonality.
Yeah, absolutely, absolutely. So, well, they do. You just have to say to them, "What have you done?" And they're like, you know, it's like, "What have you done?" And they're like, "Oh, I don't know. Am I going to get a treat?" Maybe that's just my Labrador that does that.
That's all dogs.
Yeah, I think it is. I think it is. And your downloads, I love, absolutely love that. Having those downloads, I think that is a great idea. Having that, your 6 steps of the perfect consult. They could even have that at the bottom of the clipboard so that their clients can't see it, and you can just flick up and just go, "Oh, hang on, yep, check, right, done." You know,
those 2 things, having a poster on consult steps and managing my stress and anxiety, with 2 tools I used most. So when I was looking at providing things for people, I was like, well, that's what I found most useful as a practicing vet. So I hope that others find it useful as well.
Oh, absolutely. Yeah, I think they're brilliant. I think they're brilliant. So so thank you again for joining me today. It's been lovely. And again, I get a lot out of these as well, because I love listening and hearing other people's ideas, but also it helps me to get a lot more insight as well, you know, into what it's like being a vet, because obviously I have a fair idea, like working in the profession, but I don't know what it's like to work as a vet. So being able to see things from a different point of view is really helpful and beneficial to me as well. So thank you again for that, and you're welcome. You're welcome. So, and I hope for everybody watching that you've enjoyed our webinar today with Dr. Claire. We'll make sure that we're sharing the links as well on the Facebook page when we're sharing the post, and YouTube will try and put them up. I'm not sure if I can put comments up with the links there, but if I can, I will. If not, obviously just press rewind and go back to get Dr. Claire's details, obviously details of her online course, into the promo code that she's very generously given to our wonderful followers. Copies of the book, so all the bookstores, all the online places as well, that you said to get a copy of the book, and absolutely downloading those handouts as well. I think they're going to be awesome. So I hope that you've enjoyed today's webinar on having the perfect consult and got a lot of benefit out of the webinar, and look forward to joining you on the next webinar that we're presenting. Thanks everyone for joining. Bye for now.